Welcome to HealthTech Showdown, where groundbreaking healthcare innovations accelerate their growth by 10 times. Join us as visionary founders pitch their solutions to industry leaders and investors. We're not just funding dreams, we're helping companies close deals 3 times faster and scale efficiently. From digital health pioneers to breakthrough medical devices, this is where healthcare innovation finds its proven path to market leadership.
Welcome to HealthTech Showdown. I'm your host, Sabrina Rumbach, the CEO of PostPoint Pass. We have the honor of bringing you an amazing panel of judges with the exciting thing of this game show, the one and only focusing on health and wellness innovator companies for them to close more deals and get more funding. So now, without further ado, let's introduce our amazing panel of judges. We have first up is Alex Fear, someone who has been in the industry for a very long time and very experienced, who is the managing partner of MedStar Venture, who runs healthcare venture funds and accelerator events and challenges. Began back in 2008 in New York City. Then global community has been built for healthcare innovation with enthusiasts including patients, nurses, doctors, startups, investors, and healthcare leaders of all kinds, and has been becoming a network that recognize, invest, and enable the success of early stage healthcare companies. And together, they have helped thousands of new innovations. And then we have Ron. Thanks, Ron, for joining us from Aquilius Ventures, who is their focused senior business development manager with over 20 years working in various plans implementation, and has a history of leading successful sales teams, highly trained with various style of outreach techniques, penetrating the industry verticals to turn prospect into clients. And we have the amazing Chloe here with us, who is also one of our partners with PostPoint, with over 15 years of experience in brand strategy, customer engagement, and life cycle marketing, especially in healthcare and technology. She has the privilege of working with some of the amazing brands out there like One Medical, Centric Health, to help them scale, innovate, and truly connect with their audience. And today, she's excited to see the groundbreaking ideas that all of you have brought to the healthcare and with us today. All right, let's bring out our first round of contestants. Number 1, Nima. Okay, so we will have Nima brought to the stage.
Good morning, everyone.
All right, so Nima, you will Megan start a countdown timer, and then you will have 2 minutes to go.
Perfect. Good morning. My name is Nima Shea. By background, I'm a medical doctor and a neuroscientist and founder and chief guacamole maker at Hummingbirds AI. Hummingbirds AI is a computer vision company that we develop leading computer vision products for different markets. And our state-of-the-art product is called Guacamole. The problem that we are facing and we are solving is a problem that we all have, and that's access to the computers, the passwords. How many times that you go in front of the device in a hospital or in different scenarios and you forgot your password, or you don't have your badge, or you don't have your device for multi-factor authentication? In fact, security teams are making authentication harder and harder for employees, from doctors, nurses to every organization, and that's become a big pain for employees, turning to something called authentication fatigue. What we do is we solve that problem through computer vision. The computers behind my back, you see the screen is blacked out, the information is protected. Now this is the sci-fi part. You see, this is the future. In order to unlock the computers, I just need to look at them and they're unlocked. That's it. And then when I don't look at the computers for a few seconds, the screens are blacked out and the information is protected. That's it. So we don't need to go through the pain of passwords, logging in, logging out, forgetting to badge out. The patient is having an urgent scenario, and we are just looking for our passwords. So the solution for the go-to-market is now we are working with Intel to bring that in front of the OEMs. The largest OEMs in the world, they are very excited in the product and it's going to be embedded in their platforms later on. This is a solution that would change and revolutionize the way that we are interacting with our computers. Every computer has chips. It's now time for guacamole. Thank you.
I can't hear anything. Just me. Sabrina, I think your mic is off.
Yeah, you're muted.
That was awesome, Nima. It's great to see.
Awesome. Now let's get. We have 1 to 2 minutes to give Nima some feedback.
So I thought you got to the point pretty quickly. Your timing was excellent. You're right on point with the solution. I like how you tied in the healthcare application. Obviously, there's lots of applications for this technology. I would have liked to have seen more about why this is distinctive and why this is better than just using your regular cam. But we've talked about a lot of this before. But really great job, Nima. Really great to see you performing like this.
Yeah. I like how you actually went and kind of, brought in, who your target market was a little bit, saying everyone. And also how you're tying in not only you guys' expertise, but also bringing the expertise of Intel as well. That really brings value.
Yeah, I was going to piggyback on what Alex said as far as, I loved the timing, and you did definitely get everything across that you needed to get across in that very short time. So that was great. I would like to hear more about the, sort of a little, pull back the curtain a little bit about what is the product behind what I'm seeing on the screen and how that's a differentiator in the market. And then if you had a little bit more time, you could talk about how it would help, not just, in a hospital setting or in a medical setting, but how it could be expanded across different markets. So good job, though.
I appreciate it. I'll keep those for the 3-minute pitch later on. I will go through that as well. Thanks for the feedbacks.
Perfect. Next up, let's bring on our next contestant.
Hello, my name is Ross Youngs. I'm the CEO of Biosortia and the founder. What we're doing is we've created a revolutionary technology for getting at nature's hidden drug-like molecules. Problem is throughout life sciences, but especially therapeutics, is molecules that have been sought have not been able to be obtained. In fact, less than 1% of the drug-like molecules that nature creates have ever been accessed, but it produced 50% of the drugs on the shelf. Our technology is revolutionary, not practiced anywhere in the world. Took 14 years to develop with partners like ARPA, DARPA, US Air Force, NIH, Los Alamos National Lab. And we work with people like Stanford, Ohio State, University of Michigan. We are ready to fully execute this technology as a platform. It'll create a massive amount of IP in therapeutics and diagnostics. It will extend into agriculture and sustainability and well beyond as well, as these molecules are impossible to obtain any other way. The other beautiful part of what we've been able to do is our molecules that come from nature will fill data sets that make machine learning and AI accelerated, putting us in a position where we can actually feed not only pharma companies and biotechnology companies, but data set companies that are trying to advance molecules into the clinic. It's a large market. We have a great deal of experience. And as a seasoned entrepreneur and engineer, we feel confident that this is going to have an impact on humanity. Thank you.
Thank you, Ross. All right, let's hear from our judges. Ron?
I like the delivery. I wish you would have, you talked about the big market. I wish you, kind of would have touched a little bit on, maybe what, like what separates you guys from somebody else that already has the technology out there or is already working on it, and how you guys actually plan on being number one within that market, or at least leading
Um, I will be brief. I would love to hear a little bit more about I bring in at least one very relatable, widespread pain point that this technology is going to solve. And yep, what Ron said, how are we going to differentiate outside of, you mentioned the big names that you've worked with, DARPA and, these government associations, as well as some of the top medical research schools and institutes in the country. That's great. But what is it as far as the pain points and in comparison to other tech out there that might be doing the same thing that you are different from? And how is that going to accelerate you?
Yeah, so I agree with what Ron and Chloe said. But honestly, I think you should have gotten to what you're actually doing, like within the first 4 seconds. So I mean, start out with, hey, less than 1% of all of the possible molecules have been found. We have a better way to find it. We use X, Y, and Z to do such and such, and then talk about your amazing expertise as displayed by all the trophies behind you. So I really wanted you to get to that. It sounds like you have something interesting, but you only briefly mentioned some of the hows. Obviously, so I always want people to go, why, and then what, and then how, and then here's us, right? So I would have loved to see you do that. It sounds like you have something very interesting, but I just don't have enough information. Thank you.
Thank you.
Awesome. Thanks, everyone, for the insight. Let's bring out our next contestant. Megan, start the clock.
Where in your life are you settling for mediocrity? Are you doing what needs to be done in your business because it's what has to happen to make your impact? Do you ever wonder if your work is fulfilling your greater purpose? If you answered yes, my friend, you are settling for mediocrity. The red flags of settling are everywhere: lack of focus, uncertainty, stress, self-criticism, illness. Yet we push forward, thinking that struggling is just a necessary part of life. But what if I told you it didn't have to be this way? Genosa is here to disrupt the cycle of mediocrity and bridge alternative and traditional medicine, a new breed of healthcare practitioners dedicated to supporting visionary entrepreneurs in every facet of life. Our core offer, the Genosa Map, your personalized instruction manual to make your best better. Why did I create the Genosa Way? Let me tell you about my 65-year-old Aunt Christy. At the end of her life, she was housebound, receiving in-home care and getting worse despite every medical intervention. Within 3 months of working together, Christy went from sponge baths to showering on her own, bedridden to tripling the distance she could walk. If she had started sooner, she would still be alive today. The healthcare system needs to change, and I want to support the 3 million entrepreneurs making those changes so it's easier for them to do their job. When you apply the Genosa Way to your relationships, health, business, and personal growth, it's easier to focus on creating your world impact. The leading cause of business failure is lack of focus. I've personally witnessed this cost companies $10 million in revenue, over $52,000 in team mistakes, countless hours of wasted time, and fractured relationships. The Genosa Map guides your focus so you are always in line with your impact goals. I'm seeking strategic partners who are passionate about healthcare reform to save them $1 million in revenue. Contact me at shauna@thegenosaway.com.
Thanks, Shauna. Chloe, you want to go first?
Sure. Shauna, I align and agree with what you're doing. I want to see more excitement because I know you're super excited about it. But what I would have started with is the impact statement of, the healthcare system needs to change. Here's how much wasted revenue and mistakes happen. And then you can, because that's the real problem. And then you go into, have you ever felt X, Y, or Z? If you're answering yes to this, then you're our audience. And then talk about the map, what it does, the benefits of it. And that just would have been, you had all the elements there. I just would have reordered it and be excited because this is your baby amongst a few others. So but good job, and you definitely had all the elements there.
Ron?
Hi. Honestly, I actually have to agree with Chloe. It was literally, it was very captivating. It was like, the moment you started talking about it, I just drew in and I was just like, tell me more, please. And it's like, I really want to be like, stop the timer. I want to hear more. So I think it's literally like my only downfall with that one, where it's like, you actually had, like all your pieces of the pie right there all laid out. It was just, I just wish you would have had more time so I could just hear more. So
Thank you.
good job.
So just to piggyback on them, your hook was outstanding, right? You opened up really strong. And I love when somebody makes you imagine something, makes you laugh, gets your attention. So you did that with, suffering mediocrity. But then I thought you lost a little focus and energy when you didn't sort of close on that, when you didn't say something along the lines of, wouldn't it be great to be excellent all the time? We help people do that, and especially in healthcare, something like that. As you can tell, we used to do a show called Fix My Pitch. So I always think about, I wish she said this. I wish she said that. So I'm not really sure exactly how you guys execute on the vision that you explained. And I would love to know more about that. So in terms of a good teaser, great teaser, got my attention, which as you can see is difficult. And I want to hear more.
Great, thank you.
Awesome. Appreciate you, Shauna. All right. So then we're going to bring on our next contestant on stage. Claire, you are using a deck, correct?
Yes. About to share my screen. Let me know once you can see.
There you go. You can go full screen. And Megan, start a timer. Claire, you can go whenever.
Hi, everyone. I'm Claire Beskin, co-founder and CEO of Empallo. In 2021, my grandmother passed away unexpectedly from what turned out to be undiagnosed, poorly managed heart failure. Her experience is not unique. Heart failure and other cardiovascular disease more broadly kills 1 in 5 Americans and costs the US $1 billion each day. Empallo is increasing access to cardiovascular care with our AI platform that monitors cardiovascular disease and helps manage medications. This enables nurses and nurse practitioners to take on more tasks previously done by cardiologists and increases access in the healthcare system. This enables patients to access more quality cardiovascular care at lower prices. We are able to do this efficiently and effectively with our proprietary technology that turns complex data into clear and actionable next steps for providers. Our core tech predicts clinical trajectories for patients, helping us to determine who's worsening and intervene early to keep them stable. We also have NLP to automate what would otherwise be manual tasks in clinical workflows, such as chart review. Cardiology is a huge market. The US spends over $300 billion each year on cardiac care. We're starting in heart failure, which is a $30 billion market. I'll take a moment to introduce the rest of the leadership team. My co-founder, Ray, has a PhD in computer science from MIT, where he focused on developing machine learning models in heart failure. Our medical director, Dr. Dana Weishar, is an advanced heart failure cardiologist who ran heart transplant cardiology at Kaiser Permanente, Northern California for about 20 years before joining Empallo. Our ask for the audience today is introductions to accountable care organizations. Empallo helps ACOs keep their patients out of the hospital because we provide prevention-driven medication management for cardiovascular disease. If you know ACOs who could benefit from this, please connect us. My email address is claire@empallo.com, or feel free to find me on LinkedIn.
Thank you, Claire. All right, Alex, do you want to go first since you're unmuted?
I think we're on a merry-go-round, so I guess I start this time, right? So, Claire, fantastic presentation. The only comment I would say, and it was very clear your deck is doing a great job. Two things. Number one, like relax. Like about a minute in, you smiled. I want to see more of that. And I know you can't tell women to smile, okay? But I'm saying make it look like it's fun, and it's awesome, and you're doing great shit, and you're excited about it. You know, so that's what I'm talking about. Not necessarily just like the way I am with this, right? This is super fun, right? Make it clear that you think this is awesome because you're changing everything. Two, you tell me I am a clinical outcomes freak, right? I do not care about a startup unless you are improving clinical outcomes. And as you know, there's enormous opportunity to improve clinical outcomes, especially in post-cardiac rehab care, right? And you can save money and you can make people healthier, all that stuff. I want to see that data. I want to say that 4 out of 5 patients do better or whatever, you know, or it costs this much less. Show me how it's hitting the quadruple aim or sextuple aim or whatever you call it these days. Sextuple aim is not a thing. We created it. But anyway, so I guess it sort of is a thing. But yeah, really exciting stuff, and I'm going to see more. That's it. Okay.
Thank you.
I'll let Ron go.
Oh, thanks. I appreciate that. Good morning, Claire. Excellent delivery. You know, just like Alex says, just slow down a little bit. You know, become more relaxed. Other than that, great presentation. I loved all the explanation of exactly what your platform is. Other than that, it's just all about data, right? Everyone loves it.
Yeah, I think it was very clear, concise. I liked the assist of the visuals because, and had you flashed up those, here's the outcome of our tech, then that would have been also extra powerful and really gotten it across the finish line. And I'll say another thing I really like is that you went ahead and briefly went through the smaller side of the team as far as number of people, and then at the end you made sure to state what you were asking for, as well as here's how to get in touch with me. And I think that's important always to give, here's what we do, here's how we do it, and why we do it. And then, or start with the why, but then end on, here's what we're asking for, here's what we need, here's the gap we're trying to close. So I think it was really, really well executed in that regard, and great job. I appreciate it.
Thank you.
Awesome. Thanks, Claire. All right. So now we are going into our second round. To briefly update everyone on how do we do the showdown. Round one is the 4 contestants actually gone through a boot camp before they got on stage. So for those of you who wanted to become a contestant, we do take applicants. You apply, go to postpointpass/contestant. And once we review the application and believe you are at a stage that we can support you and become a potential winner, 1 out of 4 today, where you, the public, get to vote, and 40% of the votes coming from the public and the 60% coming from our judges. And as we're giving them a couple minutes to wrap up their round 1 of judging panel, we are also today super excited to announce toward the end of our episode our winners from the 2024 Impact Award competition that we accept, and see many great innovations out there, various ideas from medtech, biotech, to educational platforms, to nutrition, to remote monitoring system. So why diversity of companies that has dare enough to show up, to compete, and to go through a process where we also, in similar round of showdown, where we do a very fast speeding round of getting you to present your idea and quick feedback. Now, the Impact Award winners also will be granted one of the seats to our next showdown. And yes, I do see on the comment section that if you want to apply, unless you have been accepted and gone through the bootcamp, you would not be able to pitch today. This is unlike any other competition that you just be able to apply last minute. And that's why this is more of a Shark Tank meets Apprentice, specifically for healthcare innovations. All right, so next, let's start taking some of the live questions from the audience. Now, we have some questions that are already pre-submitted to us. And if you guys are there in the audience, feel free to comment and elaborate. But first, one of the first questions we have is how to best articulate the strategies to investors. So we'll open up to our panel of judges to see how do we feel about that question. And if many often we talk to startups, the concern or the frustration has been, well, it seems like we have a lot of conversation with investors, but it seems like multiple conversation later, we're not quite sure if they're in it with us, or we're just having conversation, or are we talking to the wrong people, or they're just not there at all. Why not just say no to us instead of dragging us along? So there are that particular way I think we can elaborate on what's the best way and what do we need to help the startup to see there's specific information people want to hear. And perhaps it really is about they're not sharing the right strategies, or they're too superficial in the way that they're approaching, and we just don't really have in-depth analysis information to even conduct and make the right decision. So I'll open up to our panel. Who wanted to take a step first?
I'll go first. I think because I just said it, I would start with the why. Why, what, why are you doing what you're doing? Have data behind that about the market, the pain points, and then what is it? What is the solution, and how does that play out? Not just, pulling the curtain back on what is the solution and how the solution is put together, but how does it grow? How does it grow in the market? is it something that's a one-time thing, or, a one-hit wonder, as they say, or is it something that can grow and expand across multiple markets or into multiple products? And again, have data behind all of those things. Be concise, be succinct about it, and just have the data there. If you get asked the question, you must be able to give a quick answer. And then I think beyond that, just like in marketing and branding, know your audience. I think you don't just go to every Tom, Dick, and Harry to ask for help. You really need to go into, do your research on investors and do your research on financial institutions, and know which ones are within that portfolio and within what you're doing. So you're talking to the right people and you play to that audience always. So I think that's important.
Thanks, Alex. I agree with Chloe. It literally boils down to about 6 or 7 things. Innovation, what separates your technology away from everyone else in the market, and how do you address the unmet clinical needs. When it comes to business strategy, what's your go-to-market strategy? How do you navigate that the regulatory hurdles, and reimbursement challenges within the medical device, or med tech space. And then market potential, how do you elaborate on your target market? How do you intend to gain the traction when competing against other established players? And then, when it comes to the data, how do you actually get that data, and then do you plan on carrying the validation further as well to substantiate everything? Scalability, is it scalable? What are your plans for the manufacturing and distribution as you grow? And your team strengths, what your expertises are, who else you partnered up with, and then successful development, and commercialization, of whatever it is you're working on, and then your financial stability. Are you funded already? And how much are you looking for, and what do you plan on doing with those funds as you get that? That's basically all I have.
And that's great, Ron. And to piggyback on what Chloe's saying, because she said pretty much what I was going to say. Good job. But let's go on to the next level, right? So I see a good pitch somewhat similar to a good song, right? So you start with a hook, right? So one of the teams did a really great job, aren't you tired of mediocrity, right? That got us thinking, that got us listening. And then your chorus is going to be really the message you want to deliver. I can save you money in your ACO by making sure I take better care of rehab patients. But the active listening is important. So it's great having your audience on the screen if you can actually watch that, and you can tailor based upon their responses, right? So if somebody's like actively and engaged, you can see that. If they start to pick up their phone, you can see that. All these things are very clear if you're watching for the signs. And then you want to, as Chloe said, tailor your message to your audience. So for example, if you are working with talking to a hospital CFO, for example, and you want a way to reduce their cost of care, decrease the dings for readmissions or whatever, you really got to show them the financial side of things, right? Depending on who your audience is. If you got the CFO, sorry, there's a little background noise here. We're in the venture dome over here, where we got robotics labs and all sorts of crazy shit. But anyway, my point is that that you have to really sort of make it no-brainer for whoever you're talking to say, yes, I want you in my hospital. Yes, you are going to help me be better at my job. Okay, because remember, most of the people you're talking to, they have jobs, right? So they might not be on the mission that you are. You have to make it their mission to make their jobs better, right? Especially at the big companies, right? Because at the end of the day, they want to get promoted, right? So you want to make them look great, okay, for bringing you in, right? So you want to make them your champion, right? So yeah, these guys are going to reduce our cost of care by 42%. And that is what I want showing up on my, resume or profile at this company. So it's knowing your audience, understanding them deeply, having the empathy, watching for the signs on their faces when it's lighting up, when you know that you can go higher and higher. And so when the song starts going, and when everybody's resonating and singing in harmony, then you get amazing things happening. So you really have to sort of not just send out the message, but also receive the messages from your audience to get to that next level and to really, make a beautiful orchestra. That's it. I'm out. Mic drop.
Awesome. Thanks, Alex. Now, the next question, I think I'll make it more generalized. Someone who submitted on specifically a healthcare education platform, how do they get funding? Now, I feel like this can be applied to more generalized of how do we actually find the right investors? If everyone wanted to tap into that thought process about Chloe?
Look up, do your research, look up investors and VCs that specifically fund education. There are actually, I mean, that's a big one. And it's a sector where there are very specific investors that have large portfolios of educational companies, and it's very, and some of them get very specific, and they're dependent on what type of education, what the market is that they're educating towards. So yeah, do your research. Most of your top of line research is easily accessible without having some special authority or secret password. You can go and find the right people to at least begin that process. And once you start pitching, that's where you also get the breadcrumbs of, hey, this might not be my specific lane, but sounds good, and I can give you another person to go to. Here's what I would do. And I think there's a saying of like, if you go and ask for money, you get advice, but if you go ask for advice, you get money. So
I believe that line goes, ask for money, get advice.
Right.
Ask for money, get advice. Ask for advice, get money twice. And now you have to do the Christina Aguilera part, right?
Oh.
So someday in my castle.
Oh no. Yeah, me and I don't have nobody.
I don't just look like Pitbull, I talk like him.
Nobody wants to hear me sing. Not Christina, at least.
Same here. Oh no, it's beautiful. And I mean, what you're saying is exactly right. But I will tell you, there is a secret key, right? And actually, one of the things you get from entering Pulse Point Path Showdown and working with MedStarter is access to HealthTech Alpha from Galen Growth, which does give you a very amazing tool to go find those people, right? So I've been creating platforms for innovators, since 2009 or 10. And on medstarter.com, that's to generate warm leads for investors and customers and things like that. So people see what you're doing, 10,000 people see it. And then, the 17 that actually want to talk to you are going to click a button. So we've been creating things, but HealthTech Alpha is even better because it allows you to do exactly the research you're talking about, Chloe. Because if you try to get into PitchBook or Crunchbase and go detailed, you're going to have to pay a lot of money. So one of the prize package things that come with our accelerator program. So we're going to pick one of the teams, maybe two of the teams that come out of this contest and put them into our accelerator. One of the things they get, in addition to all the other things that accelerators usually give, is work with our partner and you get startup access to said data set. The third thing I would say is make sure that you attend the events and you go there with intention, right? So when I see a startup going to an event without intention, without their list of things to do, they're talking to one person, the person that they're comfortable with, their partner, their co-founder. But go out there and do the butterfly thing and go engender chaos and go have those conversations. Do your hook. Say, I've got talking dogs for lonely grandmas, or whatever it is that's going to get people's attention, and then start those conversations and then listen carefully. Watch right here. See when people are smiling, when they're interested, when they're engaged. So I think those are some of the key points that I would hit there.
Yeah, I think you guys actually topped it off. Really, there's not much I can actually add to that, except for just the things that have always helped me is that, where I've always seen or witnessed is that when people are actually, pitching, or they're doing that research or whatever, the moment they start asking for help, it's I may not be that key individual, but my community, my network, let me refer you out to them. So it's that whole thing where it's like LinkedIn, right? It's your net value is your network or whatever. That's always been like my key thing. It's like I've always leaned on my network and my community to help get the answers that I'm actually might be able to provide to somebody else, just because it's like I may not have everything.
And for everybody who's live out there, for being a live participant, we're also giving you our playbook on how to gain more funding and close more deals. So go to the closepointpass.com/the revenue catalyst. All right, let's move forward to round 3. Yay! The moment that we wanted to hear the back end of things. Initially, all the contestants gave us the 2-minute pitch and gave us an overview of the company. Now we'd like to dive a little bit deeper. Exactly what all the experts have mentioned to you. How do you create those impact? Give us more substance, the clear strategy that you're not just selling us on the stream, but you know how to combine the right resources, human capitals, and tools to make this become a reality, to make this truly impactful in the health and wellness space. All right, let's bring on our next contestant. First up is Nima on stage. Ready to go. Megan, hit.
So I start with a little bit of my background. In my background, I started from the bio-inspired AI, learning from biology and then creating more efficient models. From 2003, where we created the first decision makers that make decisions based on emotions, logic, and intuition, and now they have 400 industrial use cases. With the same methodology of learning from biology, we invented Guacamole, the platform that I just showed you, that is continuously running in the device, in the CPU, without sending any data outside to GPU or the cloud. So that means that we don't record any video, we don't record any photo, and all of the processing is happening locally in the device, making sure that always the right person is in front of the computer. So think about it as kind of like your Face ID that you have in your iPhone or Microsoft Hello. Those are amazing technologies that are for facial authentication, but they have two shortcomings. They require a specific type of cameras, like true depth cameras or infrared cameras, and also they just allow you access one time, but the user is responsible for protecting the privacy of the device and logging out of the device when they leave at that. The difference with Guacamole is that Guacamole is continuously running, and in every frame of the video, it makes sure that only the right person have access to the device. And that is something that doesn't have any competition as of now. And we have 3 IPs around the product, 3 patents, one of them issues, 2 of them non-provisional. So that uniqueness of the product is not only in the product itself, but also in our scalability and in the go-to-market of Guacamole. Think about it as through the OEMs, we are now having access to millions of devices. Right now, we are closing the negotiations that give us access to 3 million devices internationally. And that global expansion is not doable other than going through the OEM path. That being said, we are having another go-to-market strategy, which is channel partnerships, working with channel partners that can take us to a large number of the devices, specifically now talking about the healthcare, to the hospital systems, mid-sized, large hospital systems. Talking about the team, I talked a little bit about my background, serial entrepreneur. Our chief operation officer, Sarah, she scaled Positive Med, our digital media platform, to 20 million visitors per month. without and bootstrapped completely. And our CTO, he has 2 successful exits. He was the CTO of Security Compass, a Canadian cybersecurity company, and his background is cybersecurity, and he bolstered our cybersecurity position. Right now, we are asking for partners that can help us to extend to the healthcare market. Thank you.
All right, rapid fire round of feedback. Ron.
Excellent. Thank you for doing a deeper dive. All right. You took our feedback and definitely laid it up in there, which is what I like to see. It actually gave me a little bit more insight on your target market, what you actually plan on doing with the money, and also the expertise on your team. Thanks.
Yep. I'll piggyback on that. I did appreciate that you did pull back the curtain. So thank you for that. And again, ending on what you're looking for, what you're asking for, and how that would be used is good and informative. So thank you.
Awesome.
So I have a secret. Nima and I are good friends. We've worked together since 2012 on stuff. I'm so proud and happy to see you killing it here. I love the way you talked about your IP strategy, your team, your execution plan. As Ron and Chloe noted, you really brought it, for the second round, third round, whatever we're calling this. So 3 stars, out of 3, in the rating system. Normally it'd be 5, but so I think what you could have done better is show the product, talk about the 127 points that you guys are tracking and how unique it is. It's not enough to say, there is no competition, because we all know that, every time we open up our phones, it's already doing a similar thing. And why is your stuff so better? So in terms of credibility, you want to build that credibility saying, yes, we are by far the best. This is why cops are using us. That was your first pilot. I don't know how far along that went, but the idea that you could have that level of lockdown, that level of security, talk about HIPAA, talk about GDPR, and say this is critical in healthcare, and then ask for specific things. Okay, I want to talk to the head of implementation and innovation at HCA, which we'll do for you, if you get into the accelerator. So good job. And it's great seeing you really just living the dream.
Appreciate it. And thanks so much for the feedbacks. Absolutely. Thanks.
Sure.
Thank you.
Awesome. Thanks everyone for that. And then we are bringing our next contestant on stage. Awesome. And Russ, you are next. All right. Start a timer, please, Megan.
Hello, it's good to be back here to be able to give you a little more clarity and pull back that curtain. So we talked earlier about how our breakthrough technology is going to impact virtually all of therapeutics, and that how the technology itself differentiates itself from what anybody has ever been trained or practiced anywhere in the world. And that's what happens when you create disruption. So this disruption is called industrial scale microbiome mining. So we take the approach that the natural world is an excellent example, a surrogate to all other life products in the world, life humans, let's call them humans. The reality of it is that we can't get to the human molecules that impact our own body. In fact, the human metabolome database only lists 144 molecules that are made by the microbes inside of us. Yet there's likely more than 100,000. So we also know that evolution has designed life to use the same molecules over and over again. So the one source that is out there that is stable and in quantity is the aquatic world. So instead of starting with a small gram size sample, we actually start with 1,000,000 times that. Ultimately, that means there's not a molecule in life that can hide from our technology. Working with Los Alamos National Lab, we found 73,500 plus new novel molecules in one execution of the technology. That compares to the entire history of mankind finding 36,500. Those 36,500 turned into 50% of the drugs on the shelf, billions and billions of dollars of annual revenue. The reality of it is we have partners lined up. Every bit of our research is done. We are ready to execute at scale. And we've proved this with people like Lilly and Leidos and universities that we've been able to find targets in inflammation, in infectious disease, in cancer. So we are working as a platform to bring these molecules under license, under IP, into the world. And ultimately, we expect that this will impact the time and the efficiency of getting to an approved drug. We are an early revenue model because it's upfront licensing, milestones, and royalty. Thank you.
Awesome. Who would like to give quick feedback? 30 seconds.
I'll give super fast feedback. I loved that you pulled back the curtain. I think what you ended on I would have put that closer to the front, and I would have also said it in a more impactful way. Like, this solution is going to shorten the approval cycle of all drugs, in the future, and maybe flash it. That's easy data to get because the drug approval process is excruciatingly long. I know I've done some presentations on it myself and talked about shortening that cycle. So I think starting with that and that solution, and then getting into those, how much it opens up across all different treatments and therapeutics is great. And that was great to hear. So thank you.
Awesome. Thanks so much. All right. I guess my only concern was I would have liked to actually sing something, in the form of a visual, or when you were starting to explain a little bit about, your science and how you guys were actually developing it, what type of models you were using, whether it was like zebrafish or something, because you're talking about aquatics. Other than that, thank you so much. I actually enjoyed the talk. I just wish there was like a little bit more than just for the graph.
Yeah, just completely agree with Ron and Chloe. I really think you'd benefit from some visuals. I know you're probably a scientist or engineer, so the enthusiasm, the excitement. I want to see more of that, because what you're doing is you're harvesting the ocean's biomass or whatever you're doing, but we don't really know. Okay, so we're imagining a filtration system, a small molecule identification and efficacy, analysis tool, a lot of AI, and then also I want to see results. I want to see, we found these 22 candidates for Lilly, 3 of them proved out, 2 of them are going through the process of FDA, as a new therapeutic. And just the idea that we can scale and evolve, care, and faster is good. Pointing out the 50%, of molecules, that are currently used as therapeutics right now is good, but you said it twice and we were listening. Don't waste my time, right? So I think you could have used your time a little bit better. I love what you're doing. I'd love to hear more, and well done. I'm done talking. Okay, so we're filling out our forms now. Yes.
Yeah. So everyone, public, vote for your favorite company of the 4, and then let's keep moving forward. Next up will be Shauna on stage, and then let's go switch to Shauna. Shauna, will you be using a deck? Okay.
Yes.
All right. And you can start whenever you're ready.
Okay. We've introduced some of the costs and signs of mediocrity and lack of focus. So let's go into what the Genosa Way is. In our mission at Genosa, we have a proprietary process for improving each major area of life: relationships, health, business, and personal growth. We call this process the Genosa Way. It's our invitation to make your best better, your better extraordinary, and your extraordinary legendary. Our primary tool is the Genosa Map, which collects 22 points of data about a person or company and addresses how these elements influence the 5 dimensions of healing: mental, emotional, spiritual, energetic, and physical. Using our own approach on ourselves, and after 11 years of market research and product development, we have found that the most impactful place to expand our movement of health reform is with healthcare entrepreneurs. As we protect their focus and elevate the quality of their lives, we know they will share that knowledge and transformation with their families and their teams, creating the ripple effect we're looking for in our movement to improve the quality of life for humanity. With this being the largest sector of business and growing, we know that it'll maximize the reach of our movement. Right now, we have these statistics of healthcare and social assistance companies being about $3 million, or 3 million companies and growing. And they serve 20 million employees and are investing $1 trillion in payroll. So we know that by helping improve their lives and helping improve the lives of their employees and increasing their health and wellness and their resilience, that we're basically securing that $1 trillion investment they're making in their team. As we've worked with healthcare entrepreneurs, here are some of the results that we've been able to achieve for them so far. We discovered $3 million that was there ready in a physical therapist's coaching business that she didn't know was there because of her lack of focus. We mapped out a $26 million strategy for growth and expansion for a women's health thought leader. And we have built numerous teams that are harmonized and resilient, and we're able to do this within 3 to 4 months pretty systematically. Then we support our entrepreneurs and their team members and their family members as they share and grow our impact in their lives and we want to support them out of the perspective of mediocrity and keep them in alignment with their focus so that we can rocket them to their success. We do that through a mediocrity quiz as the top of our funnel and a Genosa Way book that they can share with their team members, with their family members, to help shift the mindset and expand their perspective. Thank you.
Awesome. Thanks, Shauna. And then we're going to bring our judges back on stage for a quick feedback. Okay. 30 seconds.
So, wow. I love the ripple effect, the exponential goal, right? What I did not get was how you're going to execute it. I would have loved to see you give us the mediocrity quiz, make us do it in our minds, and say, here's what we're going to do next to amp you up so that you can change the world. We could all do this together. Yay, rah, rah. Let's all get on the boat, right? So, I felt that the facts, I didn't feel the energy, and I didn't feel the experience of going through your, excuse the language, fuck off mediocrity, methodology. So that's it. I'm done.
Yeah. Thanks, Shauna. I totally agree with Alex, about the energy. I actually did like the fact that you threw in success stories in there, use cases. Other than that, just, really just bring it next time. you're a little bit too relaxed. All right.
So yes, I mean, I just want to see you more excited. I know that there might be little ones behind you too that are sleeping, but you had everything in the presentation. You didn't get all the way through it. I think having, you did exactly what I had mentioned earlier to one of the audience questions of having the data there in case somebody asked the questions, but you could have just hit on those two stats about 1 trillion in payroll and this impact just very briefly, and then gone into here's the success. And I would have started with, after you explained, did your hook again, I would have started with the visual about here's our customer journey, here's the process. And like Alex said, pop open that quiz so that, or if you don't want to pop open, pull back the curtain that much, ask the audience a few questions and get that like instant feedback, get them in the mind of, oh, I'm going through this right now. So.
And if I may take another 2 seconds. This is a construct. This person you see here, this excitable, whatever, Energizer Bunny, I'm a fucking introvert, okay? I do this for a purpose, right? This is a construct. You need to make your construct of, the excited entrepreneur, right? And everything needs to match that, right? I mean, your style, not necessarily my style, but just, build it and they will come.
Thank you.
Awesome. Thanks, everyone. All right. So then we're going to bring on our final contestant before we wrap up. Hello, Claire. All right. Let's get started with your deck.
Let me know when you can see.
Yep, we are on. Start whenever you are.
Within cardiovascular care, we're starting with heart failure. There's a few things you need to know about heart failure. Half of patients die within 4 years of diagnosis, but it doesn't have to be this way. There is a proven effective therapy that exists today, and it's called guideline-directed medical therapy, also known as GDMT. It's shown to reduce mortality by 70%, lower hospitalizations by 30%, improve quality of life. It does all these great things, and yet less than 10% of heart failure patients in the US get onto GDMT. A driver of this is that it is time-intensive and complex to get patients onto this medication regimen. Best practice, as described by the ACC, AHA, is that after diagnosis, a patient should have a medication adjustment appointment every other week for 3 to 6 months until they achieve their optimal dose. The current healthcare system does not make these appointments available to the patients who need them. We just launched our first product, which is an AI-powered clinic that keeps heart failure patients on track and out of the hospital. The new and improved heart failure patient journey looks something like this, where after diagnosis, that same week, they have a telehealth appointment with an Empallo cardiologist who confirms their care plan. After that, they're seen by an Empallo nurse every other week for 3 to 6 months until their meds are stable. From there, they'll have ongoing care as needed, maybe an appointment once or twice a year. We're working with several health systems that are sharing large clinical data sets we can use to enhance and test our platform. With the VA, we recently achieved all of our phase 2 milestones for an NSF SBIR. Phase 1 milestones for an NSF SBIR. So we're now eligible to apply for over $1 million in non-dilutive phase 2 funding. Our business model starts fee-for-service. This is a simple, proven way to get started. For example, we're in network with Medicare, so when we see a Medicare patient, we bill Medicare and get paid for it. While we're in this fee-for-service phase, we'll generate data that shows heart failure patients have better outcomes at substantially lower costs with Empallo. With this data in hand, we'll then pursue value-based care contracts. We have big plans to win the US cardiology market. Right now, we're in a data collection phase. We just launched our virtual clinic in Florida, Massachusetts, and Maine. We're starting to see patients and generate revenue. We're also running data pilots with our design partners to enhance and validate our technology platform. Next, we'll scale our virtual clinic in partnership with at-risk provider organizations such as ACOs. In the longer term, when our heart failure virtual clinic is at scale, we'll expand to other cardiovascular conditions, and we'll also have SaaS opportunities to license our platform to other clinics. Thank you for your time.
All right, quick stab. Chloe.
Claire, thank you for, again, the visuals. I think they're a great assist. My first note is you have everything here. I know that it's nerve-wracking. Whatever you're going to present, memorize it, take it in, and make it absolutely your own, because you have really exciting data here. You're doing great things. A little bit robotic on the reading. Be more like, let your excitement shine through, because it's important. And start with the current, like, have your data slides up. Start with the current system does not allow patients to make these appointments that are so needed in order to get faster treatments. Start there and then go through. And you picked up your excitement once you got to the revenue slides and what you're doing. And thank you for the growth plan. Thank you for the phases that you're in. I think that delivery was great. And it gives me the knowledge to see how far this can go and the results and impact it can have. So thank you.
Exactly what Chloe said. Awesome on the stats. Thank you so much, because I really enjoy numbers and data. Also enjoyed how you actually talked about the hardships and difficulty, on getting into the GDMT. And also, I like the fact that you went with the VA, because I think veterans are actually severely overlooked. Myself, I'm a vet, so I support that. And I think they're actually one of the easiest groups to really seriously get into versus private, medicine when it comes to on case studies. And also your growth and strategy plan was on point. Thank you so much.
Sorry, Ryan, your mic was trailing out at the end there. I couldn't really hear when you were done. And I really want to hear what you have to say. So, so one of the hardest things in healthcare innovation is knowing who the customer is, right? And knowing the economics of the cardiac rehab situation is really important here. So like you're thinking, go to VBC, go to ACOs, people that actually care because it hits their bottom line, but it actually hits the bottom line of every hospital. It's not that those appointments aren't available, is that there's not a huge incentive for the post-cardiac rehab teams out of hospitals to actually do that. They get reimbursed $2,000 to $3,000 total, and that's really just not enough to do traditional care. On the other hand, virtual care, like what you're doing, has a huge opportunity because you can take that risk off their books. They're not going to, and that always makes it sweeter when you can take risk off the books, right? For the hospital system, right? Because they don't want to get dinged for restenosis or failure. They don't want their people to die. They don't want to be known as that place that did the surgery and then left me to hang in the and die. So I think you have a tremendous opportunity, but not just in the VBC ACO market. And because it is an indirect sale, and because it's completely not obvious, how you're going to make a boatload of money on this. And if you go for the VBC market, it's 6% of the total market. Go for the 94%, right? And so what we like to do is we like to crowd validate, which is what we're doing today, right? And then accelerate, and then coordinate, and then integrate into the existing care system, right? And we have a whole model for that. So I think you're going to be a great candidate to work, into that approach, because it's really not obvious, and we only just figured it out after 27 years. So I think, and not to toot our own horn, just like I've been trying to study this problem of how you go from ideate all the way to integrate and some other 8. Anyway, so we have ideate, validate, accelerate, coordinate, integrate, and I don't know, obviate. I like that one. Obviate the existing care system. Anyway, so no, really great job, Claire. And I like to actually, I know that I'm contradicting myself and Chloe here, because Chloe's like, bring more energy. But once you get down into that detail, when you got all scientific about it, it's like 50%, 70%, that made my soul happy and made me pay much more attention.
Thank
Right.
you.
So there's a time for seriousness. Okay.
Right. I mean, and so one of the things we also talk about, we just published this on my podcast, is there are 5 different buyer persona, and there's different things that we all want when you communicate an idea for, and this buyer can be your investors, can be your business partner, can be people are selecting you for the next accelerator or whatever that means for you, right? And then sometimes it's if you're in one-on-one conversation, you have to get to know that person's buyer persona first, then you get that person's buy-in to become your champion, and then they can become a microphone for you. But if we're talking in public in general, we need to be able to hit on all of it. So yes, Alex likes to do something more scientific detail versus I'm more of a big picture. If I don't see a clear pathway going forward and a goal, I feel like I couldn't help you, right? So, versus everyone has that little bit of a tendency, and so we needed to be more fluid in the way of communicate, and that really goes for everybody, right? Now we're going to our final section. It's the exciting thing that everyone wants is what about the votes, right? So for now, we're just gonna take Claire off a screen for 1 second, and then for everyone here, we would love to see how amazing all of you guys has been doing some amazing work, whether you be in our community in Postpoint with Aquilius, with MedStarter, or with many of our other partners. We're all about how do you quickly get to what you need in the most impactful and efficient way. So that's if you like to become a contestant for our next episode, go apply at postpointpass.com/contestant. And now, if you're selected, we'll let you know within 24 hours of that application. And if you're not selected, we'll give you the 100% refund. And you also work with us for the bootcamp. Now, for this episode's winners, we will have in a second, we'll be able to announce them. But before that, we also love to share with you guys something exciting. We were able to have many judges on the panel and off the panel with the investors, the industry experts reviewing some of the most innovative solutions out there. And then we have selected our final 5 winners. So let's see who them are. Drum roll. All right. And then we have Susan Davis from Rescue RN. You're the #1 place winner. Congratulations. And second place is Christine and Connor, the co-founders for Imago Rehab. And they have a stroke rehab platform with a medical device. Then third place is Lyle and Mary Perfecting Peds. Thank you so much for tapping into that pediatric area. And then our fourth place is for Aspects. They are a newer device to help GYN exams. All right, so last but not least, our grand prize winner and the person who are actually, we're giving you $20,000 in funding to go through our Leadership Maximizer and Pathfinder to truly help you to stand out and capital ready. And by the end of it, you'll have a comprehensive system of capital readiness scorecard for your next round of race. The winner of that grand prize is drum roll. All right, congratulations, Myra from Prelude Health. And then we're so excited for all the winners that we have from the past Impact Awards. And it's a truly, definitely an honor for all of you guys putting the work. And it's not easy task. Our Impact Award is actually set up to intentionally help you to think through your business. Round one is a very quick summary of your solution. And based on your funding level, your revenue level, we are then enroll you into round two. Round two, we want all the company to truly reflect where they are. That is the exercise across 12 critical domains of your business that you need to have at least once a year reflection on. Because if you're not in the right focus, guess what? You're going to hit that breaking point. And early pre 3 million revenue, we believe the breaking point is what Chloe do really well, is that market branding positioning. If people don't understand your value, they're not going to hook into what you're wanting to do, and they're not even going to bother to say, let me find out more. And then the next revenue breaking point usually is duplicating roles, because human capital matters so much. Not so just that you have amazing board members, you have amazing co-founders with all these alkali, but how are they actually working together and assign the right role with the right tasks? And as we go on, we also understand most of the time, once you have a true solution, is how do you go to market? Can you develop the right ability to get the entire community to support you? And then we also give all the applicants, guess what? A whole plug-and-play marketing strategy to see how well they can get the community to vote for them. Just like here, we're getting 40% on public voting, adding on the score from the experts voting. And until we finalize a true winner. So we know everyone has been working really hard at supporting the community, and everyone has done amazing job presenting their solutions, and we're very proud for everyone who has served and give your insightful points to this to everything that you have put out. And I believe that everyone who's interested in any of the startup companies will be able to reach out and have some more intangible conversation. Now, when you are wanting to truly stand out, we are here to support you any way that we can, with particularly our experts from Alex and Rom, Aquilius, and many of our other investor partners, as well as experts. Okay, so I am just putting the final touches for our final winner. All right, so let's get to that. We will bring up our final winners on stage. All right, ready for the final big announcement? Okay, let's see. I'm going to remove all our judges so then we can highlight our winner to the stage. Congratulations, Claire. Yay, Claire.
Oh, wow. Thank you. This is exciting.
Yeah.
Thank you to the audience, and thank you to the judges, and thank you for having me.
Awesome. Thank you so much, Claire. And thanks everyone else for participating. So each episode's winner will have an additional interview with us to get your message out there, because guess what? You guys are the champion of your brand. And so we will help you to continue to optimize in your stage presence, your tonality, to really get the right buy-in from the community and the investors and the partners that you are wanting to establish. So we so appreciate you for being in this episode's winner, and we will keep in touch on how to move forward in the next step. And lastly, we're just gonna bring everyone back on stage to appreciate you for being judges, for being contestants. And then let's highlight this. And I welcome any last comments that you guys have. And before we signed off, and many comments in the chat is woohoo, thank you, congratulations, well done. And yes, I appreciate everyone. And any last words before we sign off?
And say congratulations to everybody. And thank you so much for sharing your heart, your soul, and all of the hard work that you've put in. I think everybody here is on a great path forward. So congratulations and thank you.
I would just like to thank Sabrina. I mean, what a great show. This is a super fun format. As you know, we've done tons of things. We have not done this, and so I love what you're doing here. It's really the iterative process of going through pitch coaching, the boot camp, all of this. You know, it's a good system. I like it, and we'll keep on working with you. I did say in the comments that we're going to send due diligence document requests to both Claire and Nima. So that's the onboarding for our accelerator program for our next class. So I'm very excited about what we've seen here today. And Mayra already is in that funnel. So really very excited for you guys and for helping you guys, accelerate.
Thank you.
Thank you so much, everyone. Literally, congratulations, Claire. Sabrina, thank you so much for including us in this. All right, it's been fabulous, even though I got pulled in at the last moment. I would gladly do this again at any moment.
Appreciate it. Yes, every episode we would love to continue to have 2 venture investor partners on stage, as well as the experts on stage to give that holistic perspective for all of you guys. We will sign off. And then for all the contestants, stay on in green room so we can wrap up. And then we appreciate all the live participants, both from people who are in our network, who apply to Impact Award, or who just wanted to also learn from other people, perhaps it's similar to their work or just a few steps ahead of them. We appreciate you guys. Until next month. Bye, guys.
Ready to showcase your healthcare innovation? As a VIP contestant, you'll work directly with our industry experts to accelerate your growth before taking the stage. Join visionary founders who have scaled their impact by 10 times and shortened their sales cycles by 3 times. Visit pulsepointpath.com/contestant to start your journey.